I just thought I'd let you know what we're doing. And my experience has been when I've been in a group and we have talked to people who are in jail. Of course, they cannot have freedom totally, but we have learned that we can have conversations with them simply by having a cell phone with a microphone. So that's what we've done. We have called Nicole Macri, and she's on the line. So we will just leave it one microphone dedicated to that project, and you and I can listen. Where is the third microphone?
Okay, here, let me just comment.
There it is. Good.
Yeah, I can hear you. Just a second. Okay, can you hear now? Yes. Okay. So now, let's test. What do you talk first?
Hi, everyone. Can you hear me okay?
Frank, why don't you try the same thing? All right, there's thunderous applause.
I appreciate the applause. Sorry, I couldn't be there.
Okay, well, I think everybody understands the treacherous conditions outside, so. But the Eagle Scout with his hiking poles made it here. All right, we're going to turn it over to Peter.
Well, just a few words of introduction. My gosh, you were fantastic to get here. You are not only our Senate, majority floor leader, right? But also just indefatigable. Well, we have this forum give an opportunity for the representatives and the senator to lay out some of their thoughts about what's happening and what will be happening in the legislature during this coming session. And then after they've done that, we will have questions. I have a few written questions submitted to me, which I can read. And then we will throw it open to the floor. We have, because of limitations right now in Anderson Hall in terms of AV, we have only one runner because we need two microphones up here to do this trick that we have right now. Anyway, so our delegation, let me say, is, I think, the best one in the state. No question about that. Really care about and work on they care about and work on issues that we care about, and we have we give them support, and they love coming here because we turn out to vote. We are usually one of the top and often the top vote turnout, even though we don't represent the entire precinct. We're about 60% of the precinct, so there are other people as well. So Horizon House is probably by itself the top turnout in the state. But the issues that we'll probably be talking about in your questions could be directed to these as well are homelessness, statewide housing shortage, healthcare, behavioral health issues, taxes, transportation, the state budget, gun control, school funding, and climate change. Do you have a couple hours? So there we are, and we will now proceed here, introducing Senator Pedersen, who you all must know. And if you don't get to know him, he loves to receive emails, don't you? Yeah. And they read, our delegations read the emails, and would like to have that feedback and get a lot of them get to know the people who are communicating with them on a regular basis. So don't be shy. Anyway, Senator Pedersen, thank you.
My pleasure. Hey, Frank and Nicole, can you hear okay from the microphone here?
It was Sorry, but I think I picked up most of that.
Okay. And
Me too. It's a little fuzzy, but we can.
okay, I'm going to step away from that microphone so that it doesn't get some feedback, but just speak up if you're having trouble hearing, okay? Okay. Okay, well, good morning, everybody. It's great to see you. Happy holidays. I'm Jaime Pedersen. I have had the privilege of representing all of you, or those of you who have lived at Horizon House for the last 16 years in the legislature. And I think I've been here about as many times, and it's great to see so many friends that I've developed over many years. So thank you all for being here this morning. Let's see, so we are headed, one thing I want to say is that I was happy, one of the surprises that I had as chair of the Washington Senate Democratic campaign was that I got to have a fair amount of influence over redistricting. And so when the proposals came to try to move the First Hill into the 37th district or the 34th district, I said, well, thank you, but we would prefer to keep them in the 43rd. So, very happy to continue to represent you all. So we are headed into a session that I think is going to be glorious in the sense that we'll be there in person. And we're going to have a chance to work with each other and do all of the kinds of things that you can do only when you have a chance to have that face-to-face interaction. The last 2 years have been productive, but I'll confess, not very fun. I said to some people, all of the tedium with none of the joy that comes out of the legislative session. So really happy to be back in person. I will say, though, that one thing that we learned from the last 2 years is that we can make it much easier for people all around the state to participate in the work that we do, and that's not going to change. So all of the legislative committees will now be hybrid, not just for this session, but probably forever. So people are going to be able to sign up in advance on the website and then be able to sign in for bills to express opposition or support. And if there's time with everybody who wants to testify from around the state, potentially to testify as well in our committees as proposals move through. So I really encourage you all to take advantage of that opportunity. We've had probably something in the neighborhood of 10 times as much public engagement in our process, from a few thousand to tens of thousands of people who are weighing in on legislation. And so that's a great opportunity for you. It's a great opportunity for us to hear from a lot of people whose voices just haven't been part of the process before this. So please take advantage of that. We do, as Peter said, have a full range of issues. I'm just going to talk for a second about what I see as the big issues that are in front of the legislature for this coming session, and then mention a couple of issues that I'm working on myself. And then I'm really looking forward to your questions and to hearing from Frank and from Nicole. So in terms of the big issues, I think the toughest issue that is going to be in front of us this next session is what to do about drug possession and the Blake decision by the state Supreme Court. So you may remember that 2 years ago, about halfway through our legislative session, the state Supreme Court struck down the felony drug possession law. And we scrambled to try to put together an interim plan that we could live with. We're in a pretty tough spot because the Republicans who, did not have the majority almost universally wanted just to make drug possession a felony again, intentional drug possession, which would have been possible under the Supreme Court's decision. I think a majority of the House and Senate Democrats preferred just to legalize drugs, but treat drug use as a public health problem and as a healthcare problem to manage. And then there was a group of people in the middle who were really uncomfortable with the idea that we didn't have the resources developed to fulfill those promises, that we didn't actually have all of the doctors and drug treatment folks and treatment beds available and built to be able to treat the numbers of people that we were seeing having substance use disorder. So we had sort of an uneasy compromise that involved saying that we would say that the first 2 times that someone was arrested, they would have to be diverted into treatment, and then on the 3rd time, they could be charged with misdemeanor. And then we put together a task force and tried to make recommendations for us. We tried to invest heavily in treatment and developing that infrastructure that we didn't have enough of. And then we made the whole thing expire after 2 years. So now that 2-year bill is coming due and we have to figure out what we want to do for the future. I don't think there's anyone who's really satisfied with that what we did in the meantime has been working very well. And for those of you who walk around First Hill or downtown and see the people scooped over their aluminum foil with their fentanyl or whatever it is that they're inhaling, it's not humane, it's not a good way for us to be dealing with people who are in that kind of crisis. So that's going to be a robust and difficult conversation that we have this session, and I'm not going to predict how it will ultimately come out. But I think we do realize that what we're doing right now doesn't work very well. I think there's a majority of people who think it would be a bad idea just to have the whole thing expire and to have no penalties and no way to get people into treatment. The other reality about that is that the state preemption would also expire, so every city could make its own gross misdemeanor for drug possession. And that would be a little bit of a patchwork mess around the state. So that's one big issue in front of us. A second one is housing and homelessness. And we see the evidence of those problems all over the place. Nicole and Frank are absolute leaders in the legislature on those issues, and I think we'll both talk about some of the work that they're doing to try to combat the problem. The governor, you may have seen last week, came out with a proposal for voter-approved $4 billion investment in affordable housing. I think there will be a whole range of solutions proposed for different parts of the problem, from work on behavioral health to investment in public housing to changes to permitting and zoning laws that will allow development of more market rate housing. And probably we need to work on all of those fronts to deal with a crisis that is of the scale that we're facing in our state. Third thing that I'll mention is that we have a huge issue in front of us in terms of education funding. For the last couple of years, related to the pandemic or to other issues, enrollment in the public schools has been down about 5%. And in a world where the state is the primary funder of the public schools around the state, and almost all of the funding goes out from Olympia in a per student allocation, that means that if we have, for the last 2 years, pretended that enrollments had stayed the same at 2019 levels. I think the patience with that approach was exhausted last session. And so now if we allow the funding to match the student levels without changes to the allocation formulas, then the 295 school districts around the state are going to have a very rude awakening in terms of their budget. So there will be a big fight, I think, in the legislature about whether we allow that to happen, and people who have other ideas about our operating budget money grab the money that would have gone otherwise to the public schools, or whether we change those formulas and allow us to make some progress on some of the things that we've talked about for years. For example, funding for special education for students with disabilities, not to be funded as it is right now primarily out of local levies, but instead to make the state pay something more like the full cost of educating those students. So that'll be a big issue for the state. Probably one of my seatmates will talk about, Frank maybe, will talk about climate change and the efforts that we're going to be undertaking on environmental issues. I'll just transition to say that a couple of things that I am working on for this next session include, number one, gun violence prevention. I think we have a good, robust agenda of things to work on. I'm going to be the prime sponsor of a bill that will impose liability on gun manufacturers and gun retailers for their negligence if dangerous weapons get into the hands of people who do crimes. That will allow the victims or family members of gun violence to have a way to sue those manufacturers or retailers if they can demonstrate that their marketing techniques or the failure to control where their products goes results in that harm to the public. And that public nuisance tort has been a part of our law since the 19th century. I think it's a very good match for this problem. I'm also optimistic that we'll be able to ban the sale of assault weapons finally this session. And so that's something that we'll be working on hard as well. The last thing that I will mention is about the death penalty. I've been working for the last couple of years with the Chief Justice of the Supreme Court, who under the Constitution is required to write a letter every year to the governor and the legislature about what he identifies as defects and omissions in the law. And this has been happening for decades. But without the legislature, I think, really getting or acknowledging these letters. Chief Justice Gonzalez was talking to me about this last year and said, "Why don't you do anything with this letter?" And I said, "Well, I'm not sure that I've ever seen it." So we started working on it. I realized pretty quickly that this letter included a whole bunch, sort of a rogues gallery of statutes that had been struck down over many decades. For example, a statute from 100 years ago that allows judges to have people forcibly sterilized if they're convicted of sex offenses. That was declared unconstitutional in 1941, but remains on the books in our state because the legislature has never taken action to repeal it. It includes a statute from the Canwell era that makes it illegal for communists to work in the state government. That's been unconstitutional since the 1960s, but remains on the books as Chapter 981. And it includes our death penalty statute, which the governor, bless him, almost 10 years ago said that he was not going to enforce any longer and put a moratorium on the death penalty. 4.5 years ago, the state Supreme Court struck down the death penalty as unconstitutional in our state, but it remains on the books as Chapter 1095 of the Revised Code of Washington. And despite a few attempts, we've passed a bill out of the Senate 3 times trying to repeal the death penalty. We haven't gotten that done. I'm hopeful that with this bill that's going to try to repeal all of this obsolete language out of the code, that we will finally be able to wipe the death penalty from the statute books in our state. With that, thank you. With that, I'm going to pause and turn it over to, I think Frank would want Nicole to go first, I'm guessing. So we'll turn it over to her. But thank you all so much. I look forward to the conversation this morning. Okay, Nicole.
Yes, I heard, I think you're gonna turn it over to me. Her
Yes.
I mean, preference, yes. Very grateful to do that, yeah.
Yes, and you're coming through just great.
Okay, wonderful. Hi, everyone. I am so sorry that I cannot, I was saying earlier, if the event was at 1 o'clock this afternoon, I would get there no problem. But as I'm watching my neighbors slide across here at the top of Capitol Hill, I just really commend Jamie for the trek, Horizon House, and for representing us. I hope you all are doing wonderfully and getting ready for the holidays and the new year. And it's great to be here. There's a lot of great things that I agree are going to be top of the agenda. I'll just for background for those who may not remember or who left before, I'm Nicole Macri, and I have the great honor to represent our district in the legislature since 2017. And I serve on the Appropriations Committee as the Vice Chair and continue to work on the crafting of our state operating budget again this year. So serve on the House Healthcare and Wellness Committee, and I do a lot of work on as well as housing and homelessness policy. Jamie covered a few really top priority issues that we expect to hear about and deliberate on this legislative session. There's, I'd like to add, one is around safe access to abortion in our state. Since Dobbs Supreme Court decision at the national level, and the many states across the country, half of the states who have imposed greater restrictions or near total bans on abortion in states across the country, we have seen a rapid increase in the number of out-of-state patients who are to Washington for refuge to seek abortion care. And so we focus on some policy issues as well as budget investment and ensure that Washington remains a safe place for people to access abortion. Most notably, there is work happening led by our colleague, Representative Hansen, on providing legal shields for both patients and healthcare providers, patients who seek abortion and healthcare providers to provide abortion care from punitive measures that other states might otherwise impose on them. And that's not only for abortion care, but also for gender-affirming care for transgender folks, because we have also seen an increase in punitive measures against trans community members in states across the country. There is also work to provide some data privacy for providers, because we are seeing healthcare providers to provide both abortion care or gender-affirming care being targeted by opponents. We've seen an increase in tests at our reproductive health centers here across the state. So not only on data privacy, but on the investment side, providing more resources so our reproductive health clinics can keep their and to enhance the security, the on-site security features at these clinics. So I've been very much involved in that, and we expect that to be a top priority this year. Jamie mentioned housing and homelessness, and I want to just mention that the House Democrats surveyed our members to get a sense of what the top priority issues are for members coming into the legislative session this year. And housing and homelessness was the #1 issue. That's not surprising. And the rest of the issues really align with what Peter talked about when he sort of spoke about the priority issues for residents at Horizon House. The other items on the list are reforming the tax code, focus on behavioral health, K-12 education, criminal justice reforms, and really providing support for overburdened communities. And of special note this year too, there's a real focus on workforce challenges. That's across the board, but really in the helping professions where the state is very much involved. So our workforce in behavioral health and hospital care and other healthcare settings, long-term care, child care, et cetera, our educators in the K-12 system, there's a real focus on continuing to support workers as we navigate out of the pandemic. Abortion care, I mentioned behavioral health. I've been very focused on behavioral health, and I want to mention a couple of things that Jamie was talking about in terms of the policy debate that is really going to dominate the session. One is around enhancing our behavioral health crisis response system, and one is around enhancing substance use disorder supports for people. And we have two relatively new revenue options to address these issues and to potentially enhance crisis response and our opioid response that may not be getting much
Hey, Nicole. Something just happened, so you started skipping out a lot. So maybe you can just, you were saying about revenue options, and they may not have gotten much, and then I think we couldn't hear much after that. So maybe you could start again from that.
Okay. What part? Sorry, I couldn't use one. I'll drop there for a second. Can you hear me okay now?
Yeah, that's great.
Okay, great. I was saying on behavioral health, on crisis response, we have a relatively new revenue stream from what is known as the 988 telecom fee. So as part of the federal effort to create a singular crisis number for folks to call, the 988 line, the federal government empowered states to enact a fee on cell phone service, essentially. And Washington was the first state to both enact that fee and set an aggressive timeline to stand up 988 services. So we have some resource there that can help us expand our crisis response services across the state. So things like crisis stabilization centers and mobile crisis response included significant new investments there for the legislature to consider. And then secondly, you may have seen the news from Attorney General Bob Ferguson around the settlements from the opioid lawsuits. So there's a significant amount of new opioid settlement dollars that I think will be your discussion as we talk about this Blake decision and how we're providing health intervention, use interventions for people living with opioid use disorder. Big areas that I have been working on in homelessness front, I'm focused mostly on budget. Know that about this as well. Frank is leading in a number of policy areas as well as but I'm really heartened by the governor's proposal to make a larger investment in affordable housing for low-income people know to address homelessness, we need more affordable housing. And as Jamie said, we will also be considering around just increasing the housing supply in general across the state, talking permitting and zoning and the requirements that go, that are developers when they are building new housing. Third piece that's on my mind related to budget that is important to note is we passed the Climate Commitment Act in 2021 or 22? 2021. Thank you. And so those dollars from the first auctions from this cap and trade approach to putting a price on carbon are scheduled soon. And so we are anticipating revenue from the Climate Commitment Act, and there are proposals for how we may invest those dollars in building climate resiliency that will help us tremendously in the arena of responding to. So there'll be policy making in this area, including around clean buildings, but a lot of conversation is in both the transportation sector and in the capital budget in the building sector and how we spend the climate commitment dollars. So in addition to all of those things I mentioned, workforce, I am very much in particularly our behavioral health and long-term care workforces and supports that we're putting in place for them. I am also very interested making sure as we make these major investments in housing and homelessness that we are supporting that as well. There was a Crosscut article that came out just earlier this week that talked about some of the efforts that I've done to help bring some stability to that, what we see coming forward in terms of the need for some of the revenues that we have historically used to fund funds across the state. And then the last thing I'll say is I've been really working issues related to hospital stability. So you've probably seen about hospitals being overcrowded. I heard the news on a much more local basis of Harborview moving some patients to other hospitals because they've been too crowded. So I've been in regular with the hospitals and with the governor's office about strategies to address challenges. And in my work to also access to healthcare generally, we're looking at how we manage of healthcare delivery in general. So we're looking at new ways to be able to draw down federal Medicaid dollars, and at the same time looking at how we can make sure that our hospital-based expenses pace the increases in costs in the healthcare system overall. So those are just some of the things that I've been working on, and looking forward to hearing more and your questions soon, and just very grateful for all the engagement over the many years.
Okay, thanks, Nicole. And Frank, do you want to go ahead?
Yeah, can you hear me okay, Jimmy?
Yes, you're coming through great. Thank you.
Can you hear me?
Yes, we can hear you just fine.
Okay, thanks. I'm speaking to you from the wilds of the earth. So, we're on the edges of civilization there. We're at 42nd and Sunnyside.
Frank?
Yeah?
You're cutting out a little bit. You may need to slow, I know you get excited. You may need to slow down just a little bit to let the speaker phone catch up with you.
Okay, I'll go to another part of the house. True. Jamie, can you hear me now?
Yeah, that's coming through great.
Hello, can you hear me?
Yeah, Frank, we can hear you great now.
Okay, well, I'm going to start and just interrupt me, garbled or something like that, if that's okay. Okay. I'm Reynolds at Wellington with a lot of ice on the road. But I'll be brief so we can get into other things. But 5 points I want to make. First of all, in terms of housing and homelessness, Nicole was correct in that our House Democratic Caucus has identified that as a really top priority. With specific revenue source that would generate $1 billion a year for the housing efforts, the Housing Trust Fund, and as well. Second point is that we want to implement what's called Apple Health and Home we passed last session, which essentially directly addresses the homelessness. A large percentage of those who are homeless are suffering from use disorder or a major physical disorder. So the theme of that program, Apple Health at Home, is say that if you have a serious medical condition, then you should have a home. A simple concept, and I'm very pleased to say that we were able to get 60. For the next. So I'm feeling really good about actually having that program being implemented.
Hey, Frank, we just lost you there for a second, so we could hear you say, talk about Apple Health and Homes, but can you repeat the budget investment?
Yeah, thanks, Jamie. Sorry about the reception here. The budget, I was pleased that last budget we were $60 million into the Apple Health and Home program to buildings to house the homeless. In the upcoming budget, recommended at my insistence, basically $100 million. So we're making real progress for the causes of chronic homelessness. Could you hear?
Yeah, we're getting about 70% of it, I think. But you said 60.
I'm going to, and I'll shut up here.
Well, Wallingford is a long ways away.
You can't connect, it's really a problem. So the third area is behavioral health, and we're working strongly in terms of the behavioral health workforce. Nicole Macri mentioned that. And one of the things I was able to do to help really move forward the whole issue is the University of Washington Behavioral Health Teaching Hospital construction right now out near the Northwest Hospital site that's near
Frank?
Hello?
Hey, sorry, we lost you. I think I know what you were trying to say, that Frank led the effort to create the new behavioral health teaching hospital that's located up in North Seattle near Northwest Hospital. That facility is under construction right now and is going to help with workforce for behavioral health, folks who are helping with behavioral health, which basically is mental health and substance use treatment. Okay, Frank, try again then.
Yeah, thank you, Jamie, for translating. The other thing is that the major emphasis to train the new wave of behavioral health professionals, mental health nurses to psychiatrists. So it's a really exciting effort. I really appreciate all this. That'll make a major difference. We'll have about 150 beds in the teaching hospital. Okay, next area is I'm working on a package of programs to help people with disabilities. In terms of helping people with disabilities, in some areas we're literally the best in the nation. Our home care program for providing home care for people with disabilities, we're actually #1 in the country. I'm very proud about that effort. Worked on it for about 30 years or more. Now, so if you look at funding for services to people with developmental disabilities, we're like in the nation. So that's one.
Frank, sorry, what number did you say for services with developmental disabilities? 43rd in the nation. Okay, thank you.
Yeah, thanks, Jamie, for translating. We have a package of 4 components that we'll be working for. And I'm really excited about the working with advocates, stakeholders all across the state. Next one is separate from that. I call it the cubby account.
Okay, Frank, you cut out there, but I know this one's really important to you. So just start again. The covenant.
I call this the covenant home ownership account. The intent is to make up for the terrible policies in real estate in years past where people of color could not buy a home in much of Seattle, let alone other parts of the state. And so I have a specific proposal, the government ownership account, about $150 million a year to go into significant houses for people of color. This is extremely important to make up for the racist practices in the past decades, but also even up the wealth disparity among different groups.
And Frank, you're cutting out a little, so let me just translate that one, because Frank has done a ton of work on this proposal. It's for something he calls the covenant reinvestment, is that right?
Covenant housing ownership account.
Covenant home ownership account. So there would be an additional document recording fee, and this would be to remedy decades and decades of redlining and preventing people of color from buying homes in particular neighborhoods or areas of the state. So this would generate around $150 million a year that would allow us to help people get into homes, to purchase homes and start building generational wealth in that way. We've been working carefully, and Frank has been consulting with a lot of people on constitutional issues to figure out how we can do this effectively. So it'll be not only race-based, but also income component. And the effort will be to try to help people who have been frozen out of home ownership for generations to get into home ownership. So, Frank.
Perfect. Jamie, that's perfect. You should translate me more often. Hey, that's it, Jamie. I'll stop now because for people to get on to questions, and I'll try to do my best to respond in a limited way there. Thank you very much for inviting me.
Okay. Hey, thanks for coming.
Well, that was great. Thank you, Adele, again for the idea and getting it started, this communication system that you used. I have some questions that were submitted to me in writing, and then we'll turn it over to the floor. Bob Knight has a microphone to go to you if you have a question to present. The first question comes from the Environment Committee, which is one of the sponsors of this event. And I understand I had to look up something to understand what this question was because it didn't come to mind. So the committee asked about the Washington State Transportation Committee recommending that the legislature adopt a road user charge as an alternative to the gasoline tax. However, they are also recommending that the road user charge be spent for highway purposes only. And that brings in the 18th Amendment. So I didn't know what the 18th Amendment was. I had to look it up, and I went to the U.S. Constitution. That was the ban on that was the 18th Amendment, was the ban on alcohol in the federal Constitution. The 18th Amendment in the state Constitution says that it restricts the expenditure of gas tax and vehicle license fees deposited into the motor vehicle fund to highway purposes. It restricts it for highway purposes. So the question is, do you believe the legislature should adopt that recommendation, including applying the 18th Amendment?
Okay, so Frank and Nicole, could you hear the question? And I'll take the first crack at it, but could you hear the question? Okay. Yeah, so what they're asking about is the Transportation Commission having recommended that the legislature can consider a road usage charge instead of the gas tax as revenue. And then the additional recommendation from the commission that we apply the same rule that applies right now to the gas tax and restrict proceeds from the road usage charge to being used for roads. So that's, the question is whether we agree with that. Okay. So I'll maybe grab the same one so that we avoid, can you hear me on this? No? Oh, it's because I turned it off. So there we go, now we're back. Yeah, I think is yours off, Peter? Okay, there we go, no feedback. So, yes, so one of the problems that we have a number of problems with the gas tax, right? The biggest problem we have with the gas tax is we don't want people to be using gas anymore. We want to make a transition as quickly as possible away from fossil fuels because of the effect that they're having on our climate. And we can see that in the world all around us. That creates a problem for us because we have relied for many decades on the gas tax as the primary source of revenue for transportation infrastructure, and in particular roads. There was the 18th Amendment to our state constitution said that gas tax revenues can be used only for roads. And the Supreme Court has given us a little bit of flexibility on that over time, so you can use them for sidewalks as well, not just roads. You can use them for facilities that are sort of adjacent to roads, so think of bicycle paths. But you can't use gas tax revenue in our state for example, transit or investments in transit infrastructure. The Transportation Commission in our state has been working for years now to try to figure out what our alternative should be for the gas tax, as the gas tax, it has clearly peaked already, and it will probably start to decline pretty precipitously as more and more people make a shift to using electric vehicles or transit or other forms of transportation. So they have recommended now that we move away from gas tax into road usage charge, as they call it. There are a lot of, so the first set of policy questions around that is, how exactly would you calculate it? Do you do it based on the number of miles that someone travels? Do we check people's odometers? Do we put in, and there are literally proposals to put in tracking devices with cars to make it more or less automatic, but that raises a whole lot of privacy concerns from folks. So I don't think there's any danger that we're going to rush into changing our revenue stream to a road usage charge immediately. Then the question is, if we did so, would we support dedicating that revenue also to roads to the exclusion of other kinds of transportation investments? I'll speak only for myself. We'll let my seatmates weigh in and say, I would absolutely not support that. I think that whatever transportation funding we have ought to be available for the full range of transportation investments that we need to make as a state. It's clear in our congested Seattle that we need to get away not only from fossil fuels, but we need to get away from single occupancy vehicles. And it doesn't solve congestion not to have those powered by gas. Ultimately, we need more people to be walking and biking and using public transportation. And so whatever the revenue source is, we need to be able to apply that revenue source to the full range of options. So that's my answer. We'll bring this back over here and see if Frank and Nicole have anything that they want to add.
Hi, Jaime, it's Nicole. I agree with you. You may not be surprised to learn.
Okay, good, thank you. Frank, anything that you wanted to add?
No, I don't think I need to add anything, Jimmy. You did a good job there.
Okay, good. Okay, we have a question that's probably best for Nicole or maybe Frank to answer. It says, Washington State has established a universal health care commission. What is it doing or working towards?
And I helped that policy that established the first in the nation ongoing universal health care commission. They have been looking at different models to expand access to health care. They're now, I believe, doing some financial modeling, and they're creating a number of subcommittees. I mean, it sounds good that we should just do universal health care, right? But it is quite complicated to transition to a universal health care model. And so this commission has been studying a number of I'll say, kind of alongside of the commission, policy efforts that we'll continue to see work happening on. We established the first in the country public option for health insurance. A couple of states have replicated that, and actually, I think have about it. So we are looking to other states to see what they're doing and to see if we can enhance our own state. We have expanded that, and thanks to subsidies at the federal level for people who are getting individual health plans on our health benefits exchange, we are moving to establish, effective in 2023, state subsidies so that people who are low income, but not the lowest income people, so people who are not be eligible for Medicaid, but don't have a health coverage, yes, plans on the exchange and receive a subsidy that allows for those plans to be nearly free or free in terms of premium cost. What we find is that while many of these plans are low cost on the exchange, they're still too expensive for many low-income people to opt into them. So this is part of our to both reduce the number of people who are uninsured and underinsured, and increase the number of people where the state is involved in ensuring their coverage. We have right now a few million people who are receiving direct support from the state in how to get their health care insurance through things like the Medicaid program and then our public employees health benefits. And as we have more and more people who are getting health coverage on the health benefits exchange as well, then the state's influence on the health care delivery system can increase. And so these are steps towards making sure there's more universal coverage and then universal administration of how health care delivery occurs. So the Universal Health Care Commission has been very useful in bringing together kind of impacted groups, so doctors, hospitals, health insurance companies, patient consumers, to inform the steps we take forward. But it's not the only place where those deliberations are happening. There's still policy work happening related to that. One of the big things to note on the universal healthcare front is that Washington just received word from the federal government earlier this month that we are first in the get a federal waiver in order to extend health coverage to undocumented residents of our state. That is very significant because over 1/4 of the people who are uninsured in Washington state are undocumented immigrants. And so this is a big step forward, and this access to healthcare and these subsidies that I mentioned for low-income people are going to be essential in our work to reduce the number of people who are uninsured, and that's towards a universal system.
And Nicole, you cut out for just a second about the waiver. Was the waiver granted?
Yes, the waiver was granted. We got word from the federal government earlier this month.
Okay, great, thank you. The waiver is well received at Horizon House.
Wonderful.
All right. Frank, anything that you wanted to add?
Well, just a couple of little quick things. One is that I agree with the things that Nicole said, and I'm very proud of our record with the Apple Health Medicaid program, and also the health exchange, and also the public option, the Cascade Care that Nicole mentioned. Those are programs that lead the nation in terms of providing health care for everybody, including when we passed the Apple Health for All Kids, we actually included all resident kids, which means about 20,000 undocumented young people are getting free health care through the Apple Health program. And they've been doing that for over 12 years. So we led the nation on that. And so the waiver that was just mentioned is the next step in that. So that's great. But I think the thing that is missing with the commission's sort of approach is a sheet to move things forward. It's important to do the research and figure out what options make sense in terms of healthcare delivery and who pays what and all that kind of thing. But we need a political strategy to actually implement something that is more significant. So I'm looking forward to future discussions about this because it's an extremely important issue. We're obviously doing really good compared to a lot of other states, but we need to do a lot better. Thank you.
Great, thank you. Peter?
Okay, we're about to start the audience questions. Before we do, I don't want to forget giving this announcement from the Environment Committee. Bill Roach is in the back of the room. You can sign up with him if you want to get current information about what's happening in the legislature on environment issues, so you know what's going on and you have an opportunity to chime in and give your opinion. So stop by the table in the back. Are you still there, Bill? There he is. Yes, he is. Okay, on your way out, we'll get in touch with him if it's too tight a time frame for you to do it right now and get on that list. And now questions, and Bob and I will be the microphone runner.
First of all, great big thanks to you, Jamie and Nicole and Frank, for being with us this morning. We just look forward to it so much. And you were talking about roads and funding for transportation and roads. What about ferries? Are ferries not part of the road system in Washington? And it seems to me that they are the last sort of group of transportation essentials to ever receive the kind of support and funding that's necessary.
You're right under a speaker. So if you're under a speaker, the black brown things, maybe hold it like an ice cream cone.
Okay.
So, or if not, there's going to be might be some feedback. Don't stand at her,
avoid the
Jamie.
black round things. Also, Frank and Nicole, the question from Ann was about ferries and about where ferry funding fits into that scheme. So ferries, one of the favorite posters that you'll see around the legislature from folks who represent districts that are dependent on ferries is ferries are marine highways. And so that actually, so we've been able to use gas tax money to help support the ferry system. Nicole and Frank brought up some of the workforce challenges that we've had generally. Frank has taken the lead really for us in working on the Maritime Academy program at Seattle Central College and trying to salvage that. There had been a proposal to shut that down. That is one of the most important pathways into the workers who do the work on the ferries. And that, in terms of the shutdowns that we've had of various ferry routes, that's been the most important problem, that we haven't had enough workers to take care of the ferry runs. And so the State Department of Transportation, the ferry system, have had to shut down runs from time to time. We have some ferry legislators who are in very important positions in the legislature these days. So the ferry system has gotten better funding. But I think regardless of whether we're talking about road usage charge or the gas tax or just investments generally, ferries are not only, of course, marine highways, they're also mass transportation, public transportation. And so I think there's a lot of interest in continuing to invest in ferries, in electrifying the fleet, and we're working on our first, I think, all-electric ferry right now. It's being built. So we're looking forward to continuing to support those investments. Thank you. And Frank, yeah, I think Frank, you want to go ahead and add to that?
Yes, Jamie, I think you did an excellent job. I didn't hear all of the question, but obviously funding for state ferries is extremely important. I grew up in East Bremerton. I used the ferries a lot when I was growing up, and even nowadays as well. So we've done better in some regards in terms of, for example, providing new capital funding for actually building new vessels in the shipyard over in Bremerton. So I'm all in favor of shipbuilding, particularly for the state ferry. The area that is most pressing now is the workforce challenge, and I frankly am fairly upset about how little work's been done effectively in order to ensure that we have a maritime workforce, particularly for the state ferries. They have canceled many runs on many because they didn't have enough deckhands or whatever, and that just is atrocious. It should never have fallen into that kind of lack of proper management. So we're doing our best to bolster that effort. There's a new head of the state ferry system. I've met with 3 times now. I think they have a good plan, but we have to implement the plan. But this is something that should not have fallen to such disrepair as it has. Anyway, so we're doing our best to help provide the funding and also oversight for them to get the job done to support the ferries. Thank you.
Yeah, just one other thing. I agree with everything that Jamie and Frank have said, and I think workforce is really the focus. I wanted to mention that the Maritime Academy that is up here in Seattle is one thing. There are efforts happening now to establish a maritime program in Pierce County as well. I think at the high school level, which is great. So these are just small things, and I agree that we need to do a lot more to support the workforce. I want to comment that we have a new member joining, Julia Reed, in the 36th district, and she's come in very clearly saying that supporting and developing the maritime workforce is very, very important to her. We lost a great champion on maritime issues when Adele retired from the legislature. She had worked and had been a commissioner with the Port of Seattle and had really pushed for investments in maritime workforce. And so it's great to have Julia now joining and really coming with a particular focus on that.
Thank you.
Thank you all for coming today. It's really nice to have you here. Coming, whether you're electronically or physically, it helps. It's heartening to hear all of the wonderful things that the state legislature is doing if you three had your ways. Just a word about the other side of the legislative budget, which is how the state gets the money to do all these wonderful things, namely the tax code, the revenue side. There has been, as many of you know, a group working for the last 3 or 4 years called the Tax Structure Work Group. And they have a website, you can look it up if you want to see what they've been doing. But they're made up of a couple of senators, a couple of representatives, a couple of people from the governor's office, the Department of Revenue, and some other organizations, public officials, policy-making officials. And they were tasked by the legislature to study what the people of the state really think about the various tax issues, the different tax models, the different tax consequences. And they have been going around the state conducting rather elaborate opinion determining activities, large, complicated questionnaires. Thousands of Washington citizens have fed into this system, and they've now issued their report. And it's really quite interesting. And my question is the legislature now poised to do something to move ahead in this area? Because there are a lot of things in that report that suggest that public opinions were not quite what we've always assumed them to be. I noticed, for example, that more than half of the people who file these questionnaires are in favor of a graduated income tax. There's still 40% of the people who are not. But the idea that the Washington voters would never, the Washington citizens would never tolerate an income tax seems simply not to be consistent with this evidence. Now, these are not surveys of voters, and they're not surveys according to some elaborate statistical plan for selecting questionnaires, but it's something that is quite responsible, and I think the numbers are quite significant that these changes occur. So the question is, what is the legislature going to do with this report now that it's in? And I hope they give it some significant weight in the policies they devise. Thank you.
Okay, so Frank and Nicole, the question from Bill was, what are we going to do with the report from the tax structure work group? So I'll take a first crack at it, and then I'm sure both of you will have some things to say. So let me say the first thing is that in 2021 we took a giant step by enacting the capital gains tax and then doing the working family and enacting as well the working families tax credit. And so that was a huge step toward progressive tax reform. Looming on the calendar just over a month from now, on January 26th, the state Supreme Court will be considering the constitutionality of the capital gains tax. Now, I remain very optimistic that we're going to get not only a good decision from the state Supreme Court that the tax is constitutional, but I think that this court is going to take that opportunity to say that their whole line of cases stretching back to the 1930s that said that income was a form of property, and so the constitutional restrictions on property tax, in other words, that it has to be applied uniformly, so you couldn't have a graduated income tax, and that the cap is 1% of the total amount, so you couldn't have an income tax above 1%, that those apply to an income tax. So that's going to be tested potentially in this capital gains tax lawsuit, and I'm hopeful that the result of that lawsuit is that the legislature would then have the flexibility to enact a graduated income tax. Now, the flexibility to do that does not mean that the legislature or the people are going to be prepared to do that immediately. I think there's a lot of additional work that needs to happen to get us there. But I think I'd speak for all three of us that we're ready to vote yes as soon as we get to that point. And it would be nice to have it in a situation where it required only a simple majority of people. Frank has taught me over 16 years that whenever we're talking about taxes, although there are people, a lot of really smart people who think hard about systems and understand the importance of making the changes to the revenue, in the political world, we need to start with what we need, with the investments that we need. We need to start with convincing people that there's some issue, some need in the public that we have to fund. And so the abstract question about reforming the tax code for the purpose of making it more progressive or more fair or whatever is not necessarily one that resonates with voters outside of Seattle. We need to start with the very clear needs that we have, whether that's investments in public schools or in college or in daycare, or if it's investments in housing and homelessness or behavioral health. So we want to start the conversation there and then work backwards into, well, how can we pay for that if we have this flexibility? The tax structure work group's work has been excellent. They've talked a lot about a range of things, not just a progressive income tax, but also how could the B&O tax, for example, be blown up and redone so that we had a business tax that made more sense in our state, either based on net income, or there's a margins tax proposal that they did quite a bit of work on. None of those things, although they've had a lot of work within the tax structure work group, none of those things has been socialized yet within the legislature. So my prediction is that we're unlikely to see any of those advance, particularly, and the wealth tax is another one that was the subject of significant discussion. We're unlikely to see those advance in this session, but I think that there will start to be significant conversation around that, around a lot of those proposals and the concrete details of them. And I suspect, particularly if we get a green light from the Supreme Court, that over the next few years, we'll see some real fruit from that process and the investment of time and energy that not only legislators but citizens around the state put into those questions. Nicole and Frank, do you want to add anything?
Hey, do you want me to respond then next?
Yeah, Frank, why don't you go ahead?
Yeah, thanks, Jamie. I want to say to the crowd there that we were always students, by the way, and all that. You talked about me instructing you, so thanks for the shout out. Yeah, the thing is that we have to always have a winning political strategy when we talk about reform. If it's just seen as an intellectual exercise, it doesn't stand much chance with the general public. If there are efforts to repeal the tax put in place. So we, for the last several years, done a series of investments, and that's number one. Talk about investments. And Jimmy brought up the perfect example. That's the capital gains tax, but we led with the investments in child care learning.
Oh, Frank, sorry, you were cutting out there for just a second. We heard about the investments in child care and early learning funded by the capital gains tax, and then didn't hear after that.
Yeah, Jamie, sorry about the cutting out. Henry, the main thing is that on progressive and would definitely improve the progressivity system, so the state tax system is a lot less unfair. So I've got 4 proposals we're working on and getting support for. So I'm hopeful that we can make at least some concession to, again, invest in our people with specific programs. Second, dedicated account that the money would go into, the actual revenue source that would make sense to the people of the state, because we need a legislative, a public relations strategy, and a legal strategy. So I'm working my tail off on these things. Yeah, I think we'll make some progress.
Okay, and so just to make sure that people could understand what Frank is working on, I think at least 4 different progressive revenue sources with an idea that there would be funds dedicated to particular purposes, and he has some particular purposes in mind, but wants to emphasize how important it is for us to have a political strategy to defend any new revenue that the legislature enacts. Okay? Frank, did I get that correct?
Sounds good.
Oh.
Apologize. I agree with everything Frank said about the strategy here and the assessment of the tax structure work group. I need to leave to go to another meeting, and in part it's for my work at DESC. Because of the weather, I've been sort of on call here. It's really in the many sites where they're supporting people who are homeless or recently housed. I just want to thank everyone for having me. I'm so glad this worked out that I could type through Jamie's phone and to hear your questions and comments as well. Encourage you all to reach out during the legislative session over email or calling her. And I know I will see some of you in Zoom meetings and occasionally down in Olympia this session. Okay.
Okay, thank you.
Well, it's about 11:30. There was one additional hand raised, now 2 hands raised. If you think that it's a really important question that everybody should hear and hear the answer to, wave your hand vigorously. Okay. There are 2 right now, so...
straight between the 2 of them.
I'm interested. Thanks to you guys all, a wonderful delegation. I want to have some reform, though, of the legislature itself. What I would do, and of course this is a romantic notion, not to consider so many bills, to ban the word working on, and to do more oversight and less passing bills. It's so easy to put in bills and have hearings and people come and all that. I would have the legislature spend 2 days on legislation, 2 days on oversight, and 1 day on reflection. And that basically, and the reason is there are issues like the issue of spending time on studying universal health care is ridiculous. I have always, and all the doctors I know are fervently in favor of single payer, but we also know it's not going to happen. But I think you all are not looking at immediate issues. For instance, Medicare Advantage, the promotion by big insurance companies of Medicare Advantage. I was called on my cell phone here at Horizon House by attorney, and they knew my name, to promote a big company. It happened to be United Healthcare, one of the largest in the country, to sign up for Medicare. How could they intrude on senior citizens with actions like that? Oh, you want a question? No, I'm giving lectures. No, I'm sorry, guys. The other thing is, are you paying attention to the biggest crisis in healthcare right now, which is the collapse of primary care, and that and the personnel of funding nursing education and an infusion of nurses to meet the loss of primary care? Sorry.
And Frank, did you hear Abe's question?
It was really garbled, Jamie. Sorry. Was that Abe Bergman, by the way?
Yep, it sure was. He had some comments about our process generally, but his specific question was about what we're doing in terms of the preventing the collapse of primary care and investing in nurses and I think other workforce to try to help out primary care. Did you want to take that one?
Yeah, I can briefly say, but Dave's support over the years for many other things that we've done. I agree with him about care being a priority, and each part of that is to help on expanding the work placed in the family practice and things like that. So I'm looking to expand the Workforce Education Investment Act that we passed in 2019 that went to provide free college and university tuition for all students. But targeted workforce investments in healthcare, and we need to use that so we're hopefully expand it to provide a lot more support for people going into healthcare critically needed at the ground level across the state, including family practice. So Abe and I can get together for coffee again sometime soon. Not this morning. So I hope I answered something about that. It was very verbal, is what I heard.
Yeah, no, great job, Frank. And we might say as well that Frank was instrumental in the repurposing of the old Pacific Hospital on Beacon Hill to be largely remade into a health teaching facility for Seattle Central College, where a lot of workforce education is going on right now. So obviously we haven't done enough, but that has been a focus of our efforts.
Thank you, Frank.
Thank you, Frank.
One more question.
Mine is quick. You talked about the gas tax, gasoline tax. All these electrical vehicles have to plug in. Have you considered, even though I realize that might be difficult to implement, but has that been considered to somehow tap into those plug-in machines?
Yeah, so the question is about whether we've thought about taxing electric vehicles. Step away from the black circles. We did actually impose a fee on electric vehicles, an increased license fee when people renew their car tabs, which then has had pretty furious pushback from people who say, why on earth would you make it more expensive to own electric vehicles at a time when you want people to purchase electric vehicles? So I think the same thing would probably happen if we tried to tax or put an additional tax on electricity for folks. But the point is that, and this is really the idea of the road usage charge, the point is that over time we are going to need to have to tax people in some way for transportation, and figuring out some different way so that owners of electric vehicles can participate in making sure that the roads are paved and the potholes filled and whatnot is going to be an important task for the legislature. So yes, we're working on it. I'm not sure how that'll happen. Okay, Peter is waving goodbye. So Let me just, before we wrap up, let me just give Frank a chance, and I'm happy to stay. I'm not in a giant hurry, so I'm happy to stay around and answer your questions. But let's just give Frank a chance before we let him go to say any final words. Frank is...
Yeah, Jamie, thank you very much for that. I really appreciate the connection, but also the translation. So thank you again. Severely to be there in person. I always enjoy the gatherings with Horizon House, and you folks have of any precinct, I think, in Western Washington at least. So I really appreciate your anxious involvement in public service and voting and things like that. So I look forward to maybe having another opportunity where it could be in person with you to go into more detail about these I think we're going to make some progress this next session, but the one thing that I don't think has been addressed much is that the current state of this current state budget is, it looks daunting because there's a lot of inflationary increases that we need to consider. And so when you do all that, plus also trying to help the hospitals, that Nicole man, and other things, the budget probably be very, very tight. And if you look long term, we need to really see what we need to do for the high priorities of the people of the state, which does involve sometimes raising some resources to meet the needs of the people. So anyway, thank you very much, all of you. It's good to hear. I heard some good voices there from friends of mine, so I appreciate all of you being there. And thanks, Peter, for also helping on this thing. Peter's been very helpful on housing issues going back many years. So thanks, Peter. Thanks, Dave. Thanks, everybody else. Take care.
Okay, thanks, Frank. Bye-bye.
So, there are so many things. First of all, this turnout is spectacular. We didn't know if 2 days before Christmas anybody would come. This demonstrates clearly, and we'll tell the folks who didn't see it in person, that is Frank and Nicole, how marvelous this turnout was. So thanks to you. Jamie, you are a hero. Safe travels back on Capitol Hill. And that's wonderful. Don't forget to check in with Bill Roach if you want, either now or later, if you want to get news on a regular basis of what's happening in the legislature on environmental legislation. So everybody have a wonderful holiday. Thank you for being here. It really inspires me, as well I'm sure it inspires Jamie and the other legislators. Thank you. Bye-bye.